The third session for today will be in a topic mobilizing resource to enhance medical education. It takes a village. The moderator was supposed to be Dr. Bizu. In the absence of her, I am the moderator, Dr. Berku, Yosef Berku. Our presenter is Dr. Sabla Freyot. She is a professor of global health in the Department of Health and Policy and Management at the George Washington University. And Dr. Sabla has extensive experience in global health with more than 2 decades of experience in the world setting in health policy and various health-related issues in the world. Without further ado, I will introduce Dr. Sabla.
Thank you so much for the introduction, Dr. Yosef, and for P2P for having me here to tell the knowledge and the wisdom that we learned from a very vast initiative called the Medical Education Partnership Initiative that occurred about 5 years ago, but it's still sustainable till now. My focus will be on the role of international partners to give an overview of what MEPI is. We call it MEPI in short. It was an R24 NIH grant from 2010 to 2015. It wrapped around 2016. It was a $135 million investment of the US government over 5 years. I'll come on its objectives in the next slides. It was funded by PEPFAR and NIH and administered by NIH and HRSA. It didn't stop there. After mid-2016, the international partners who were working on MEPI went on to collaborate with NEPI. We have our sister program, Nursing Education Partnership Initiative, and currently it lives through AfriHealth. So MEPI was the largest grant the US government, I believe, has ever given to Sub-Saharan Africa for a number of medical education initiatives. There were 13 medical schools in 12 countries initially. But then these 13 medical schools in 12 countries grew by mid of MEPI year to over 40 African countries, 40 African universities, 17 American universities, 2 British universities, and 1 Canadian partner. There was a coordinating center, which is at George Washington University, which I was the principal investigator with a colleague of mine, dear colleague of mine that passed 2 years ago. And we were collaborating as a coordinating center with the African Center for Global Health and Social Transformation, which is situated in Uganda. We formed what are called the PI Council, the 13 MEPI PIs, as well as the coordinating center. And we were the ones who were leading the initiative throughout the 5.5 years. We used the Node Excel to map networks. This is just a microcosm of the network that was created just from 13 schools and their partners. There's no way I could put the whole network in 1 or even 10 slides, but as a microcosm, I put this out there for all of you to see how much networking was being done in collaboration internationally, nationally, as well as locally. The MEPI Coordinating Center, in brief, why was it important in fostering international partnership? We had certain goals. We went and visited all 12 Sub-Saharan African countries' medical schools. We conducted programmatic survey, evaluated educational models, and we built something called COP, Communities of Practice. This is what the main focus of my presentation today is going to be. We spearheaded a peer-reviewed publication, consortium-wide, and we identify best practices across these 13 countries, medical schools, and also organized 5 Sub-Saharan Africa annual medical education symposia. So what were the themes of MEPI? What did the US government wanted to achieve? First is increased capacity, not just in quantity, but today we've heard in the accreditation presentation, quality is so important. The second is, it's one thing to say increase capacity. It's another thing to say retain whom you have increased capacity for, especially in rural and underserved areas. So we focused on that. The third is on regionally relevant research. Many institutions do research that has no impact for that country. Many outside institutions come and do research in Africa that has no relevance to African countries, but we concentrated on regionally relevant research. The fourth is sustainability, and the fifth is building community of practice. For the sake of what I've been asked to talk about today, lessons learned about international partners' role, I'm just going to concentrate on building communities of practice, or COPs. So what are COPs? I believe the best definition came from McDermott, who said communities of practice are groups of people who share a concern or an interest for something they do, and as they gradually interact, learn to do it, they learn to do it better. And a wise person that I really have such great respect of in the Ministry of Health of Thailand said, networking is the highest form of capacity building. So how did we start with 13 schools in 12 sub-Saharan African countries, ended up with 40 medical schools, 17 partners in the US, the international organizations at the national as well as international level. This was done, it was hard work. This was done through being a catalyst in 7 areas. And we call these communities of practice, tangible and virtual actions. What were they? We created TWGs. All this I'll come in brief in the next few slides. PI site visit exchange, annual symposium, MEPI journal supplement, MEPI website, MEPI newsletter, and MEPI webinar. And what we did was, these programs were at the national level, but we took them at the intermediate level, meaning that we connected them to the other African country medical schools, and international level, to Asia, to Latin America, to Europe, and the United States. So we would have never gotten this huge R24 NIH grant. Our portion of the 135 million was 12.5 million at GW if we had not done something before that. And that is about 3 years before that, the Bill and Melinda Gates Foundation asked us to find the status of medical education in sub-Saharan Africa. We collaborated with a number of institutions in 10 countries, did a full 51 countries survey of the status of medical education, and published a Lancet article as well as the book that you see on the left-hand side. Through this, we created network, international partners. Because of that, only we were able to apply for an R24 grant. What we have learned here and what we learned in MEPI is there's so much knowledge next door. Whenever in Africa, something is needed, most of the time, one looks to the north. But no, when we go and visit deans from medical schools of different medical schools in sub-Saharan Africa to their neighboring countries, or across to the central or the western part or southern part, or with each other, they find the following. One, in the area of faculty that they didn't have, there are faculties in surplus in another country, or vice versa. And plus, they started exchanging ideas, exchanging good practices, and built communities. And one of the best lessons in SAMS, in the Sub-Saharan African Medical School Study, as well as in MEPI, is what we call this important lateral exchanges. There's so much richness in Africa, but there's hardly much South-to-South partnership. And this is key for fostering international partners' role. The second is we intentionally created what are called TWGs, or technical working groups. In the US and Europe, we take it for granted to have surgeons group or infectious disease people group or different groups. But most of those groups, they don't exist in Africa. And so we created the community-based education task force, because we had found in Sub-Saharan Africa Medical School Study, there are 2 kinds of medical education in Sub-Saharan Africa. One, they were direct copy of the colonial countries' medical education, while the others were community-based education, where they based their curricula based on the global burden of disease of that country, of that region. We focused on e-learning TWG because whether we like it or not, the world is moving towards that. Our young generation, our children, they are quite well versed in that, and it has a job to do. E-learning can really fill a gap that even residential learning cannot fill. We also brought together for all these 8 TWGs at the international level, national level, and local level, the Monitoring, Education, and Evaluation Task Force, the Research Support Center Task Force, the Graduate Tracking Task Force, the Medical Education Research Task Force, Competency-Based Education Task Force, which, by the way, it's so important in the accreditation topic we talked earlier, and the Librarian and Information Science. For anybody that has question, I can go in depth what these groups did. Then it's very important to bring different colleagues from different countries together, like we are doing, for example, right now. So we had 5 annual symposia. The first was in Joburg, the second in Addis, the third in Kampala, the fourth in Maputo, and the 5th in Harare. And this was planned with great intention. We really looked, whom are we going to invite beside the consortium that there is between the 14 medical schools and the 17 in the United States. We made sure to those meetings, we invite public and private regional global funders. Let them come. Let them see what we are doing. Let them ask us, so that when we go and apply for grants, we don't need to prove it to them. They have already, during the annual symposium, it has been proven for them. So we made sure every year the World Bank comes there, Bill and Melinda Gates Foundation, the Wellcome Trust, and then African Development Bank, JICA from Japan, the DFID, the Global Fund, and all used to come there. But above and beyond that, it's one thing to do the job. It's another thing to market what we're doing. And sometimes we, in academia, we're not good in marketing. So we used to bring to those meetings the editor of Lancet, the editor of Academic Medicine, the editor of New England Medical Journal. We used to bring them so that they can whet their appetite and say, oh my gosh, this needs to be written, so that when we apply for supplemental issues, that there is no barrier. So this is the fruit of that. It took us a year, the MEPI Coordinating Center here at GW, to organize this. We created a MEPI editorial board, and we approached academic medicine and said, okay, what you have seen, we want to tell the story to the world. So they said to us, we can have a full supplemental issue. And after a year, we published these 33 articles. To date, it's the largest collection of analytical papers about medical education in sub-Saharan Africa, ranging on many topics. We had 225 authors, and we put together 85 individuals from across the globe to review these papers. This is very important. Without publication, there is no way that we can go and approach and get these huge grants that either the World Bank or the United Kingdom or Japan or Germany or even the United States put out, because we have to show track record. The other thing we did was we called it our town square. Literally, everybody who wants to know about MEPI or work on MEPI, they used to come to our website. We made it purposefully a dynamic website and not a static website. And we used to put in there noteworthy news, events, MEPI stories, live videos. I'll come to the library in a bit. Each TWG had their own paper that they can just log in and put whatever they want to do on that, plus the annual symposia had its own webpage. So when we started, people who used to come and see the website were from 21 African countries, but it grew to 51 countries, and by the end, 120 countries used to come and view the MEPI website. One of our main sites that people used to come and see is the library page. Why? And we take for granted, those of us in Europe and US, that we can get access to peer-reviewed literature anytime we want. But not many medical schools or nursing schools or universities, they can't. So that we were told there is huge shortage of access to resources. So we made sure we worked with the journals, and they made sure that we put the link or the full PDF of about 860 articles organized in 16 medical surgical field categories. And this site is to have the 500 hits a day. Then we had monthly newsletter as well as webinars. The newsletter always highlight a topic in medical and health sciences and public health. And this combined with the webinars, in all this, in everything I've talked so far, the international partners, we included them, the regional partners like Afro and all, we included them, as well as the local partners, we included them. But through all this, each could find something to do, something to contribute, and something to help the MEPI program grow. So all that I've just said, because I was given 15 minutes, I tried to keep my presentation on time. This is my second last slide. We have published it. We have published how did we do this. Right now, in many universities in Europe and in the United States, students are doing their PhD thesis on MEPI. How did MEPI become so sustainable? What was the community of practice model of MEPI? So we have published that, and we have also our year 5 report. So finally, all I can say is, what's the role of international partners? I think our Ethiopian idiom says it best, "Dirbiabir ambasa yasir." Now, we need these international partners. If we cultivate, it's just like, I always tell my students, like marriage, what you put in it, you get out of it sometimes, or a good relationship, friendship, what you put in it, you get out. So it's tedious work, but the dividends are incredible. So again, Dirbiabir ambasa yasir, and I hope I finished on time.
Thank you. Yeah. Got the right time. Thank you, Professor Sabla, for this informative presentation. So the next presenter would be quite well known to you, Dr. Kebede Benya. He is Associate Professor of the Consultant Hematologist in Mayo Clinic, Rochester, Minnesota. The topic would be the role of the diaspora experience from the Mayo Clinic Global Bridge Initiative. Dr. Benya.
Thank you, Josie, for your introduction. So what I'm going to do is, among all the activities we are doing, me and a friend at the same institution, try to, Mayo Clinic is a very huge institution. Most of the consultants have oversee or Mayo Clinic abroad approach. So most of them, they go to developing countries and they create really a very close relationship with those countries. People come, it is a win-win relationship. We believe in win-win, not only one side, both sides. We go there and people from that country also come to us, especially in the last 2 years, because of this Zoom and webinar, a lot of things are accomplished. So what is Mayo Clinic Global Bridge team is, these are really the most important people who's Dr. Ken Merel is a radiation oncologist who has close relationship with Ghana, and Dr. Taylor Hurst is a very senior physician. And really the engine of those team is Kati. Kati is executive director. Really, without her and also Minda Rank, we wouldn't have done what we have done in the last 2 or 3 years. So really, it's the need for improved cancer care, particularly in the low and middle income countries like Ethiopia, is burdensome. I don't think we need to spend a lot of time talking about the burden of cancer in developing or resource-constrained countries. And it is really attacking or killing those who are in the cream of their experience. Most of the time, people are dying when they are between the age of 50 and 70. And after many decades of experience, life experience, educational experience, we may be losing a lot of people. So this is really timely. Actually, 1 year, I joined really People to People 2017, when the topic of the whole day was on cancer and cancer care and control in Ethiopia. So the need for cancer care in Africa is enormous. It is, there is low awareness, limited screening or no screening at all, and the diagnosis is very, very late. 17% of the population in Africa have access to less than 5% of resources or diagnosis. And the workload for African oncologists is very, very higher than the rest of the world. And 50% of African nations have actually no radiation facilities. Even though there are some facilities, most of the time they may not be working and overburdened. And there is really limited capacity for research or clinical trials. Most of the medications that the African population are getting, they didn't pass through the people who are taking them. And we are extrapolating from different countries. As you know, the genetic background of an individual may have different outcome to the same kind of disease. So the lack of really research and clinical trials maybe have a tremendous impact on the day-to-day activities of care. So how we started this is, as I said, Dr. Ken Mered, a radiation oncologist, have been going to Ghana, especially Kumasi, Ghana, for the last decade or more, and I have been going to Ethiopia for a number of years. And because of this long-standing relationship, we used or leverage the existing relationship to increase first Mayo Clinic to Addis, Mayo Clinic to Ghana. And our really main objective is to increase the south to south, Ghana to Ethiopia, Ghana to Kenya and Tanzania. That was the objective behind those missions. If you see the big lines at the beginning, there will be a lot of dependency or a lot of exchange between Mayo Clinic and the two centers. But at the end, our emphasis, maybe after 5 years or after 6 years, we have less input once they are self-sufficient, once they are able to stand on their 2 feet. So as I said, it is a collaborative structure established between 3 institutions at the beginning, Ghana, Kenya, and Ethiopia. And really the main aim is to create online. Initially at the beginning, it was before COVID, so we have to switch our means of communication with them. And we have created online training program for cancer research training program for Africa, and online core oncology lecture series, which has been going on every Thursday because of the time difference. And also there was a medical physics training program. So the pilot project, the first one consists of online really didactic sessions called Fundamentals of Clinical Research. It is a 5 credit hour. Really, I purposely took it to refresh the knowledge the medical students are getting when they are in the epidemiology, I believe in preclinical too, in the old curriculum, where you learn a lot of statistics, you really learn a lot of epidemiology, and it's fun, and most of the people who attended the course were happy about it. And the second part is a mentored research project. And the research topic is going to be picked what is relevant by the people from Addis and the people from Ghana. And they will have their own local mentor and also experienced mentor from the West, from different institutions, even though mainly from Mayo Clinic, Rochester. And at the end, there will be a publication support. And this is not coming without any fund. Really it is, so we have to give them, they will prepare their own budget, they will prepare their own way of objectives. They write up based on their, and we help them to prepare the budget, and we send the money to them. So without really having such kind of funding, none of the projects would have been accomplished. So this is the structure. So the low and middle income countries identify their learners. At the beginning, it was only Tukurambesa Hospital, where is the only oncology teaching center, and we connected with them. And the leaders choose the second year or third year medical oncologists. These are residents. They choose a topic. They will be their mentor, and they choose the topic, and they will contact with us. We edit it, and we suggest really constructive comments. And they are doing it while they are preparing this protocol. They will also take a course on FunCats, Fundamentals of Clinical and Translational Sciences. It is a video. There are 3 e-learning. They have to score more than 80%. It is given to pretty much any researcher at the Mayo Clinic, and they have been taking it there. It was free of charge. And the second part is called Essentials of Clinical and Translational Sciences. As most of you know, in fellowship or in master's program, I myself took a master's in clinical research. So this is clinical researchers. These are MDs, but they are going to equip themselves with the knowledge of clinical research. So as I said, they will prepare the interests to the topic. They will have local mentors. They will be also mentor from us, and they do those time in about 6 to 12 months. They collect the data, they analyze it, they may include a statistician, and they write it up, and they send it to different organizations for their abstract to present on international organization. And at the end is publication, not only publication, because they use the information. Usually research create another question after question. In addition, these are hospital-based research, and we believe it will improve the care they are giving to our mothers and fathers. These are the input we receive from these learners at the beginning and when they are finished with the FunCat activity. And there are a number of oncology lecture series. We chose the topic and the speaker. The speaker include really most internationally well aware about the situation in third world countries. And we picked important topics, and it was well attended by medical oncology residents, staffs, and other people. So what are the benefits of this strategic partnership? One, there was only one coordinated program at Mayo, even though some of the speakers and participants or mentors are from Harvard, MD Anderson, and other also UPenn. It includes both education. We are giving oncology lecture series and a clinical care. We help them whenever they have difficult case. And really the most important thing is how to identify your problem and how to find a solution. Unless you know your problem, it will be difficult to find a solution. So these are what we have achieved so far. Dr. Rose is now a junior faculty at St. Paul Millennium Medical College. She was a junior, a final year medical oncologist at Columbus Hospital. She was studying on breast cancer. It's a prospective study, and she wants to identify whether there is any kind of awareness about our mothers and sisters who are diagnosed with breast cancer. And this really creates a very additional advantage because of she's emphasizing on breast cancer. We're able to collaborate with another center, another breast oncologist from Canada through Dr. Andreas Lemma. Dr. Andreas Lemma is one of the graduates from Jimma University. He was also my student. So through him, since he works in Canada, this lady also interested in to do breast cancer studies, and really we are working hard with the Carolina group and also Dr. Rose. The second one is Dr. Rubishet Jote. He is a nephrologist. Actually, he is the only nephrologist in Melik Hospital, but he have a adjunct faculty appointment as St. Paul Millennium Medical College. And he's trying to study, as most of you know, whenever you do chemotherapy, the chemotherapy has to have some kind of adjustment or modification based on the kidney function. So what he's trying to do is, because most of the studies are done here, what the chemotherapy that we are giving them, is it appropriate to the Ethiopian population? So this is the study that he's doing with his mentor, as you might know, Dr. Momina, one of the nephrologists in Ethiopia. And the third one is Dr. Trumabes. She is the only hematologist in St. Paul Medical College. Yeah, she actually did a retrospective study about lymphoproliferative disorder. She also wrote an abstract, and it is actually accepted for American Society of Hematology this year as a publication only. And she works with one of the hematopathologists in St. Paul Hospital. This young, too energetic, really medical oncologist, you can see, I am imagining myself 20 years ago, like Dr. Elias Amara and Dr. Yohannes Alamayo. These are GPs in Ethiopia. Currently, the sequence is from general practitioner, you go to medical oncologist. So I met them, really, they are very strong, very nice, very energetic. And Elias is studying about locally advanced rectal cancer. Rectal cancer is very common. I can't forget, always I remember one of my professor who died because of this when I was a medical resident in Blackline Hospital, because he thinks that it was hemorrhoid. So he died at the peak age of his life. I can't forget it about him. So he's really doing a very nice study, it's cross-sectional study. And at the end, he knows how to prepare a budget, he knows how to write abstract, and he has the potential to present it in, and also may change the way things are done in Blackline Hospital. The other one is Dr. Yohannes Alamayo. He's also a senior medical oncologist in Tukurambesa. He's studying on head and neck cancer. As you see, all of them has their own local senior consultant mentors. The other one is Dr. Nahum Wundesen from Haramaya University, Ethiopia. He's recently graduated from the Tukurambesa Hospital. He went there and he wanted to study hepatocellular carcinoma. So what are the risk factors for hepatocellular carcinoma in the region of Somalia? Is it that is contributing anything to this? He said it is very common hepatocellular carcinoma. So he's trying to study at least some kind of observational study that may lead to a different further study. So there may be a thinker, a doer. So somebody was asked to choose between the thinker and the doer. I think it's maybe better to be both. I like both. You have to think what you want to do, but not only thinking is enough. I think doing something is also important. I am trying to, I try to show you this because by persisting, we may be able to achieve something. So what is next really for, what's next for, through this collaboration, really we are trying to establish a hematology medical oncology fellowship program at St. Paul Hospital. The good thing is there is a good receptor from our Ethiopia side. The faculty in St. Paul Hospital are eager to have this fellowship. They know the advantage. They know it's going to improve the quality of care our people are getting there. And hematology oncology fellowship means everything. It starts from diagnosis, prevention, treatment. Really, it is very huge. It may take 1 hour or 2 hours to explain about the hematology and medical oncology fellowship. The good thing is they are on the process of curriculum development, and I wouldn't have said this only because of this because through the support of the institution where I work, and also because of the mentor I have. Actually, there is going to be a funded for about $250,000 over 5 years. And the fellows will come and they do some kind of clinical work and research, maybe 6 months per year. It's one of the best centers in the world. So it's not only coming there, because when they come there, they will learn the process, and also they may take someone with them to that country. So it's going to be a win-win for all of us. The second thing that we have planned through people to people is teach based on life experience. This is some kind of initiative taken by all the people that you see there, including Dr. Girma Tafera, Anton Habte, and also Abraham. The plan is maybe to have one individual per month to speak about his life experience. How did he achieve this one? So it's not going to be here only in the West. It's going to be in Ethiopia. This is the idea phase. Hopefully, we will achieve it. The other one is need-based lecture from universities and colleges. Instead of us asking that I want to give you lecture, I want to give to this kind of education, I think it should come from the people who are doing the day-to-day activities from the universities and the colleges. So if they have a consortium of colleges, you see, because of this and this, we need someone to give us a lecture or some kind of course, some kind of workshop. It is easier for people to identify someone. I can call 3 or 5 people, thanks to whatever the reason. There are a lot of people here in the West who wants to give back, not only financial material, rather knowledge. So that is our objectives. The other thing is, the other thing is research, advice, and grant. Really, always I talk about this one. So we have to think how we are going to be self-sufficient in terms of grants. Those grants which we went to our brothers and sisters, how can we create such kind of grant? For example, National Ethiopian Research Fund. So there are people who want to donate that one. Somebody has to take the initiative. I remember 3 years ago when we went there to Addis, to Kurambesa Hospital, some of us volunteered to donate for the Kurambesa Foundation Fund. That was not materialized because of some reasons. So what I'm calling all the people who are listening here is to think of some kind of national research fund. As a very meticulous or smart-minded person from Bonga University may propose his research to those bodies, and that should be funded instead of just asking from getting money from the West. So I'm sure if somebody takes that initiative, this kind of funds can be created. So we have to think outside the box. So these are the limitations. Yes, time is important. Logistic support, a local partner. So how should we sustain this? It has to be a local partner. And the good thing is we have a strong track record, proven people-to-people platform to accomplish this one. Thank you.
Thank you. Thank you, Dr. Very excellent presentation. I don't know if we have time for questions and answers for the presenters, but if we don't have any, we go to the next session. Thank you.
Thank you.
Good afternoon, everybody. We've come to our last session. Thank you for staying alert, engaged throughout the day. This session, which I usually think of as the best session, not because I'm moderating it, but because it speaks to the core values of people to people, the concept of triangular partnership, where the diaspora serves as the bridge between our institutions in Ethiopia and institutions abroad. So we just heard Sabla and Kabada speak about their diaspora experience, how they leverage their institutions, they leverage the opportunities to give back to the countries or sub-Saharan Africa, etc., because they have more experience with that. They have ownership. They have a lasting, enduring interest in those countries. So that is what makes it special. So people to people have been focusing on this concept of care delivery. So on the other part of it is the institutions in Ethiopia, as we spoke about. So we have a fantastic guest today, which kind of outline what this collaboration looks like. We have a more established university and younger medical schools. So I will not take a lot of time, but give them opportunities to kind of introduce us to their institution, and also kind of tell us how we can best collaborate. Because as was mentioned several times, it's about meeting the needs, about responding to the needs in country, and not about deciding what we want to do there. So without further ado, I'll start first with Dr. Faris Dalil. He's the president of Wolgite University, one of the newer medical schools who just graduated their first batch this past year. So he will share with us his experience and how best this concept of triangular partnership will work for Wolgite. So,
good afternoon, everybody. First of all, I would like to thank People to People for inviting me and my university to participate in such a historic conference. It's very historic from 2 points. One is where we are right now, how we are coping up with the challenge. The other thing is I just landed and directly joined this conference from Ethiopia after going through very strenuous 12th grade students examination duties given by Ministry of Education. As introduced by the chairperson, my name is Farish Dalil. I am the third president of Wolgite University. I am a veterinarian by profession, and I joined 2.5 years back. This is the newly established university. To say a few words about Wolgite University, it was established by 2012. It's a decade age. That time it was established with 13 undergraduate programs under 3 colleges. And now the undergraduate programs are increased to 51, and we do have 29 postgraduate programs. Among these programs, 2 of the programs are recently established. There are 2 residency programs, one in surgery and the other is obstetrics gynecology. Where we have 3 campuses, one very mini campus, one main big campus, and the other one is a teaching hospital. And our university, after the Ministry of Education initiative to differentiate universities, is categorized under University of Applied Sciences. And we do have 8 colleges and 1 school. Among the 8 colleges, College of Medicine and Health Sciences, 1. Under this college, as I stated before, we have 7 programs: medicine, public health, nursing, midwifery, medical laboratory, pharmacy, and anesthesia that will commence by next year. The other things, as I said before, School of Medicine, in addition to its first batch that graduated a month back, we have 2 residency programs. After having these 2 residency programs, the quality of the clinical services increased. So now we are planning to increase the residency programs based on the people demand by coming years. This hospital is only 3 years old, and it was established following initiation by the Gurage Culture and Development Association, because this association tried to build this hospital because there was no referral hospital in that area. But after starting the hospital, because of lack of budget, they were not able to finish it. So our university took it in I think some 7 years back, and so we finished it 3 years back. And now it's serving for more than 5 million people in the catchment area. The whole Gurage, part of Oromia, Yam Special Zone, and also part of Hadia, we can say. So even if it is a young university, during the last years, this university, this hospital, this infant hospital was able to shoulder many challenges that was posed globally and at the national level. The first one is COVID. When the global pandemic occurred, our hospital served as a COVID treatment center. Plus to that, it served as a diagnostic center by having a real-time PCR. In addition, the university also involved in producing sanitizers, personal protective equipment, and creating awareness to the community. The other thing is the war between TPLF and our country. At the university level, we contributed more than 36 million in cash and in kind, including 1 month's salary from the whole staff. And the other thing is right now, even if this university is infant, during the 3rd round of conflict, we are treating more than 100 casualties that are fluxed from the northern parts. Our initiative in the future is one is to work on trauma, because in that area, road accident is very common. So we are planning to be the center of trauma treatment center. The other thing is psychiatry. To tell you a few things, when the hospital was established, it began with only 4 programs: internal medicine, surgery, pediatrics, and gynae ops. But by this year, because of the public demand, we also started serving additional programs. Among these, psychiatry program is one. We established using only 20 beds, but these 20 beds are 100% occupied. So because of this, the other initiative what we planned is to work on psychiatry. The other further focus area that I was expecting from this morning session discussion is that even if the medical schools for general practitioners, the integration of the theoretical and practical part is well linked, the integration of the other health professionals with the practical is not as such strengthened. So we are planning to strengthen or to integrate the other health programs and the staffs with our medical schools. The other initiative is when we were categorized at the University of Applied Science, the Ministry of Education gave us only 3 focus areas that has not included the health. So because we have huge infrastructure and opportunities, we are planning to make the health and medical education as a 4th focus area as a University of Applied Sciences. So to do these things, what are the opportunities for us? The first thing is we have sufficient staffs. We have 50 GPs. Actually, if we want to recruit, we are able to get many. We have 36 specialists, and its proximity to Addis, our capital, is the other opportunity, and also the peace in the surrounding area is the other opportunity. To talk about the challenge, as I said before, this hospital is not a proper teaching hospital. It was taken from the Grage Culture and Development. With that, the university invested huge amount of money. It's more than $500 million money invested for it. When we were taking this hospital, this initiative, that time, Ministry of Health promised us to fulfill all the infrastructure, but that promise was not kept, because who promised not right now, he's not there. I don't want to mention his name. So because of that, we began with very few equipments that we have. The first thing is even we got 80 beds from supporters who are living in Germany, those who are living in Germany, those from the South region and from that area, and their supporters. After that, also the university is trying to equip the hospital, but still the hospital is not well equipped. The other thing is the people expectation. Since this hospital is established after many years and there is no referral hospital in that area, people are expecting better quality services. So that is the other challenge. So we feel that when we began the residency program, we were worried that are we able to cope up with this or not? But now we are able to cope up with it, and now we are planning to add more residency programs. So we feel that if we say we are able to do it, we can do it, and we are expecting supports, not only in terms of materials, in terms of training too, because even if I have not mentioned it, the university is having many smart rooms, video conferencing facilities. We are planning to make the university totally with smart rooms. So with that facilities, we hope that the professionals who are working with people to people will help us to increase, to enrich or to enhance our quality education programs, including when we are doing on the curriculum. Thank you so much. That's all.
Thank you. Hey, thank you, Dr. Faris, for sharing this experience. 10 years in the life of a university is really just the beginning. So there's a long way to go. And that is where, such partnerships will help you get to the next level. So P2P will be very happy to work with Walgett. We've worked with them before, and this partnership will continue. Our next speaker is our panelist is Dr. Petros Waldesambet from Bonga University. He, we have this scarf courtesy of him, courtesy of Bonga University. He's also given us a USB and pamphlet. So make sure that you're ready to know more about Bonga University. So he's going to share again his experience, his hopes and aspirations for his university.
I thank you very much for this privilege and honor. I am Petros Woldegiorgis, the founding president of Bonga University. In my presentation, I will try to cover, or I will try to focus on the vision of Bonga University. At the same time, I will focus on the mission and the current achievements. I will focus also on the potential we have, and I will mention some of the challenges, and I will focus on the area of collaboration. Finally, I will try to substantiate my presentation by showing a few pictures. As I mentioned, the vision of Bonga University is Bonga University aspires to be one of the leading higher educational institution from Africa in 2030 in terms of natural resource utilization and conservation. The mission of universities are universal, so I don't want to mention there. We have a very beautiful motto, as mentioned by my sister, Professor Helen, in our context, we say that together we can. The university is located to the southwest part of Ethiopia for about 460 kilometers distance from the center. And it has established in 2010 Ethiopian calendar. It's only 5 years old university. Even from that 5 year, 1 year has already lost with COVID. So in terms of organization, as all you know, there are department heads, and then from college there are vice presidents. From vice president there is president, and then board. There is a very long chain of command. We have started with 4 colleges in 2010. Currently, the number of colleges has reached to 6, from which we are seriously focusing on College of Health and Medicine. And when we go to the faculty, we have for about 459 faculty members. Among them, assistant professors are only 14. So it is very simple to identify or to infer what kind of gap can be there. When I go to the administrative staff, there are more than 1,300. As far as program is concerned, we do have regular students, which is to be counted more than 6,000. And in continuous program, we do have for about 5,000 and above. And we are treating for about 12,000 students with our context. So within that 4 or 5 years, we have achieved the following points. We were recognized as an ambassador for the Green Legacy Initiative in the country. This award is given by Her Excellency, Professor Hirut, after she made a thorough observation in our compound. The second achievement we have did so far is we are the winner of the Best Ethiopian Comprehensive Universities Award of the academic year in 2021. At the same time, the winner of the Best Leaders Award among Ethiopian comprehensive universities president was given in 2021. At the same time, Her Excellency Ambassador Sahale Work awarded that university for the effective and efficient utilization of the scarce resources by saving from any drop. And then some of the achievement again, currently our Prime Minister is mentioning now and then about the achievement, what we are doing after watching and getting different information from different corners. Why I am propagating this issue is not for simple explanation. Rather, if this infant university gets some sort of support, just it is to show how best we can perform. The other achievement, what we did is we got rewards and recognition for exemplary accomplishment from regional state higher officials. Zonal higher officials also gave some research centers as a means of incentive for the best achievement we did. And again, we are doing a lot to reach to community to serve with the potential we have. And we are also providing some financial support for seniors. For example, 6% of my salary is dedicated for seniors. The 5% of the salary of vice presidents and college deans were dedicated for seniors. The whole staff, it can be academic or admin staffs, were dedicating their 3% of the salary for seniors, which you will see later on the picture. Above all, what makes us very much happy is in the history of Ethiopian higher education, Bonga University is the first to start coffee science in first degree level. There are countries even who don't know about the leaf of coffee. They are giving at PhD level, like University of Florence in Italy, University of Del Cafe, again in Italy. Of course, Kenya is giving with different status. Maybe Kenya can have a moral authority to give. The homeland of coffee is Ethiopia. Imagine one of the most export commodity what we are sending and securing foreign currency is from coffee, but for unknown reason, we missed it, and now we have started that. This year, even we opened the second degree or master's program, we have started also. We are also focusing on apiculture, and we have established Institute of Coffee Research. Of course, this Institute of Coffee Research has been taken a very long history in Jimma University, but there were no institution in Ethiopia who attempted to open coffee at a regular program. The very serious problem what we are facing in Bonga is, the hotel, and there is a very shortage of recreation centers. So to solve that problem, what we did was, by our income, we have started to build a wonderful lodge for which international researchers can reside there and they can do their research together with us. We have already started to solve that problem. Again, 10 plus hotel is started to be built by the budget of government. At the same time, some of the achievements, what we are doing so far is, we are making a unique research and development projects with the aim and potential of changing the life of society. We have started this mission at Geisha district, which is a bit far, for about 140 kilometers. And again, we have started such intervention at Goba district, which is to be 100 kilometers from our center. Having said that, so what are the opportunities we have? We do have a very hardworking, responsible, and energetic managements are there. The other opportunity we have is there is a hospitable, hardworking, and environment-friendly community. You know, the area which is endowed with fauna and flora. Again, the area is known as a birthplace of coffee. At the same time, insect is very much widely cultivated there. So the main issue which I need the intervention of primary stakeholder is the following. We do have a very serious capacity gap. You have seen the number of assistant professors. There are only 14. Among those 14 staffs with PhD are only 4. Some 10 are promoted from lecturer by publication to assistant professorship. So it is very simple to know the lacuna or the gap. The other challenge what we are facing is program accreditation, what we were discussing in our earlier session. Again, the challenge we have is, doing together, jointly doing research is one of the challenges still we are facing. Publication is one of the most challenge. Again, even grant writing, how to secure research is one of the serious problem because of the experience gap we have. This is one of the serious problem. We have opened nursing, midwifery, health officer and pharmacy, but we don't have well equipped laboratories. So that is one of the serious challenge what we are facing. So in order to mitigate or to reduce those challenges, we are calling the contribution or the support of potential stakeholders in terms of opening joint programs, in terms of doing on program accreditation, even supporting how to write research and searching for research funding, doing joint projects. And we need your rich experience. We have already built a very wonderful smart classroom. We don't have the problem of connection, so you can give us some sort of training or lecture, being somewhere in the world where it can be here from United States or from Europe. So we want also a staff exchange program. At the same time, we wish to send our students for their master's or for their PhD. And we want also to get some sort of training. It can be short or long term to fill those gaps. Anyway, within those 5 years or within those 4 years, we have achieved the following project. This is one of the best dairy farm we have. We are distributing milk for local people at 3 different sites, and our staffs are absolutely enjoying with the milk. I'm very much happy while I'm presenting this presentation because my friend Faris knows my university was a board member. At the same time, my elder brother, Dr. Adamu, have visited my university more than 2 times. So they are my witness. All these projects are currently very much effective in our compound. These are for about 70 were born in our compound. And among them, 4 again started to born. So we have seen, we are considered as a grandmother of and this is the dairy farm. Again, this is the Bonga specialty sheep production we are conserving in the compound. These are the poultry production what we are doing so far. We are getting more than 600 eggs per day. So we are distributing for the staffs, and we are sending also, we are distributing for the local communities. These are our fishery project. One of the wonderful gift of the local environment is honey. We have for about 360 beehives. This is number 4 site. We do have number 4 site. We do have 7 sites in apiary. This is a product which is produced by Bonga University. This is the nursery site number one. We do have like the other, we do have 2 coffee seedling sites. This is 3 years old coffee. Even we have started to collect coffee, and last year I remember we sold with 672,000 Ethiopian birr. From this, you can easily understand how the area is very much rich in terms of that is very much known with a very good potential. It is very simple to understand from this that food security can be achieved in a very few years. This is the inset, one of the staple food in southwestern part of the country. Even currently, there are publications they are doing on it, as it is very much wonderful for food security program. This is some 18 hectares of our compound is filled with this banana. Imagine that they don't have that experience, but we were the first to start this banana around Bonga. These are some of the fruits what we are distributing for the people. This is a pineapple project in the compound. These are the site of medicinal plants, and these are some of the recreational sites for our students. This is 1 year's apple. This site is located in Geisha. Imagine, you can easily identify, you can easily observe the potential of the area. This is also 1 year's coffee. It is around Geisha. The one with hat is Dr. Wainshet. She is in charge of research and community service vice president. You can look the infrastructure. She took her staffs and she planted for about 35 hectares of coffee at Geisha. This is the other site. They say it Goba. And there now I have posted on Ethiopian University President's Group's WhatsApp. The TIFF which is produced there is very much surprising. This is our university, how it is engulfed with dense forest. So this is the outer part of our university. Here is a motto. These are the seniors whom we are supporting. They are our guests. They came 4 times a year to our compound. In the time of our quarterly report, they are our guest of honor. They sit in front, they hear all the reports, and they dine and they wine with us. Finally, they bless us and they go to the home. These are some of our awards that we took at national level. This is after the awarding ceremony, how the people accepted us. And that's it. Together we can. So this all.
Thank you, Dr. Petros. Your enthusiasm for your institution is very obvious. And I applaud your effort to reclaim your right to coffee and put Bonga on the world map. I was surprised earlier to hear that, you would think you would not find many people in the same room with Bonga, but then Professor Sabla has a connection with that. Professor Jonas has a connection with Bonga. So it's really coming to the forefront on the world map. So we look forward to working with you too. So going to our next panelist, who is not a stranger to the P2P conference, is Professor Eshigeta Galau from Bahar Dar University. P2P has a long history of working with Bahar Dar University. We have had several projects going with them, and a few of them were highlighted earlier on. So it's one of the older universities compared to the newer ones which came up over the last decade. So Professor Ishigeta, I stand corrected. This is the panel for the newer universities, and who is actually going to join us in this panel is Dr. Antanas Dubesa from Hawassa University. So My apologies. Yeah, Hausa University is a university we'll love to hear about. So, right.
All right. Thank you, Dr. Anton, for that introduction. And I'll thank the P2P for giving me this opportunity. Actually, I came here in the US for another purpose, and Dr. Girma told me to attend this important meeting, and I'm glad I did. So
I'm glad you did too.
yeah. So I mean, listening to all the works that you do, I'm surprised why we were not working together until now, and I hope we will do after this one. So with the beautiful pictures from the previous presentation, then I'll just give an honor in your mind. I'll just give an oral presentation about about Hawassa, and I'll also highlight about Hawassa University College of Medicine and Health Sciences, and I'll select one collaborative project that we are doing with people in the US that we are trying to develop as a model, and probably people can also work with us using that model. So, so Hausa University actually is not a young university; it's one of the senior universities in the country. So, Hausa University currently hosts more than 30,000 students under 81 undergraduate programs, 108 master's level programs, 16 PhDs. All right, sorry. So 16 PhD and 10 specialty programs in medical specialty programs. So it's not a young university. It also has 8 colleges and 2 institutes, and Hausa University College of Medicine and Health Sciences is one of the 8 colleges. So under our college, we have about 14 undergraduate programs, including medicine and pharmacy, nursing, and many more. And we have also about 17 master's level programs. We have 10 residency programs and 1 fellowship in gynecology oncology and 1 PhD program in public health. Regarding the clinical service, we have a 450-bed teaching hospital. So our hospital serves as a referral center for southern part of the country, all of the Sidama region and part of the southern Oromia, and some part of the western end of the Somali region also comes to our hospital for service. So the project that I am going to tell you about is the Hawassa University American College of Surgeons Operation Giving Back Surgical Teaching Hub. So under this program was started in 2017. So the American College of Surgeons has a program called Operation Giving Back. What this Operation Giving Back is doing is, it collaborates volunteers from different surgical programs in the US and works with countries in the COSEXA region, that is the College of Surgeons of Eastern, Southern, and Central Africa, and to make those selected sites as a training hub for surgical training. So luckily, our program was one of the first programs that started as a pilot program. So this collaboration includes Hawassa University with 13 surgery programs here in the US. So what we did under this program was, essentially the program started in 2017, but mainly we spent the first 2 years, 2017 and 2018, with baseline assessment and joint planning on what the needs at the ground are and what this 13 program can deliver for us, and identifying the teams under which we can work. So during this time, we have identified 5 thematic areas that we can work on. So those thematic areas are like the education piece. So one area that we work is on surgical education. So under this surgical education, what we actually do is, and one thing, provide the surgical education by itself. So what does a surgeon as an educator can do, and also provide point of care trainings for our faculty, and the faculties that come with this under this collaboration will give talks to our residents and faculty, and they also help us, moderate and be a discussant in different teaching sessions, like the morning meetings and mortality morbidity session, journal clubs, and things like that. So under this program, the aim was also, to look for and and provide fellowship training for our young faculty. But after we started the actual program in 2019, so COVID came early and we couldn't proceed with that part of the project. But the others, even during the COVID, it was going on with virtual presence. And the second was on research and in the education. So it was not only the surgeons that were traveling to Hawassa, so there were anesthesiologists and emergency medicine physicians who were traveling under this collaboration. So they also, motivated those departments to grow, and we have started. We managed to grow our faculty in these departments, and we have started a residency program in anesthesia and emergency medicine as of last year, and we are getting huge support through this collaboration. Research was the other piece. So, and as you all know, research, our clinicians back home have limited experience and limited knowledge in research. So what we did under this program was we worked under two areas. One is the research and the other is grant and grant writing. So on research, we have developed a short curriculum, and we've trained our residents and faculty on the basics of research and up till how to analyze data and how to write manuscript, all the phases. And we have established a team of one senior and two residents from our side and one mentor from the US side. And we developed different projects. And now under this, at the end of the third year, we have publications that came up through these collaborations. We have case reports, we have articles, we have conference proceedings, and so on. And many of the projects are on the process of being completed. So it's going very well. And under grant writing, so grant writing training was given for our faculty and residents, and we have made a team of grant writing with in collaboration with the faculty here in the US. And last year we have submitted 3 grants, and we got one. We won one grant of about $675,000 USD from USAID funded grant, and the other 2 actually had a good score. But we're planning to redo those grants, resubmit this year, and we have also identified 2 other grants that we are going to work in the coming to 2023. And the other was, in doing all those things, quality improvements. Programs are one thing to do, but we have limited experience and have huge experience in doing quality improvement program, both in the education and in the clinical service. So we are working on those areas as well. The other important area that we're working with was trauma system development. So one of our thematic area, as I've told you when we start this project, was to do on the trauma systems. And luckily, the Ministry of Health also started the initiative of MESIP, the major city initiative to develop the pre-hospital trauma system. And these 2 projects, coincided, and with the huge knowledge, huge experience and potential from this side and the need from our side. So they have helped us a lot in, establishing a basic working pre-hospital trauma system with many of the protocols and trainings that we are doing. And we are also able to provide the team training. It's called the trauma evaluation and management training. We've given this training for our faculty, our residents, and emergency room nurses also, and we've also given for our counterparts in Jumma as well, the same project. I'm not sure if it's given for Bardar as well. I think it was. So during COVID, we were able to provide those trainings. And we are also going to promulgate ATLS training, the first of its kind in Hawassa, the first quarter of the coming 2023 under this project. So we are doing quite good in this area as well. The other important piece that we are doing is the clinical care. So, it's what we previously know is faculties going from, especially from well-developed countries, they used to do medical missions, doing surgeries for, bread and butter procedures that anyone can do if they have the resources. But we try to avoid that. Rather, we concentrated on training and experience sharing. But if the faculty that come have special training, specialties, we didn't want to miss that opportunity as well. So we have used those, to do some procedures that we are not used to, and also give us training on some of this. So we've started minimal invasive procedures, but essentially in the Department of Surgery of this collaboration, and we're used to do some liver procedures, pancreatic procedures, and these things not only giving service for the people, it also created some sort of interest in our young faculty, and we have a couple of those doing their fellowship now in Addis as of last year by those things. So it was quite good. And there is also a philanthropy piece to there are faculties who travel through this collaboration, doing some looking for some donations and so on. We have received about about 150,000 USD worth of surgical equipment through this travel. And if you consider the time spent by the faculty, we have, before it was interrupted due to COVID, we have received around 38 US faculty who traveled within a span of less than a year. So that was a huge experience and a huge investment from that side. So through this collaboration, so OGB was arranging the travel and recruitment of the faculties, and Hawassa University was arranging the programs in accordance with our residency schedule, and we are also providing the lodging and the accommodation during the stay in Hawassa. So we've learned that if we can have a joint planning, if we do need a detailed need assessment, and if we can identify the actual needs on the ground, I think with the commitment of both partners, we can develop such kinds of fruitful collaboration. So that's what I want to share with you guys. Thank you.
Excellent. Yeah, thank you, Dr. Antana Mokshe. Indeed, Hawassa University is a big university, a lot of interesting initiatives. So we look forward to working with you in the areas you've identified. Our last panelist is Mr. Robert Bergman from Human Bridge in Sweden. Again, this is a demonstration of the third leg of the stool. We talked about the diaspora, and then we talked about the Ethiopian institutions, and now what these do again is bring the third part, Friends of Ethiopia, networks within the Ethiopian friends and colleagues to work on common projects. So the Human Bridge with Mr. Bergman and his colleague, Mr. Adamu, have been working in Ethiopia for a long time, bringing much needed medical equipments and working with P2P in different capacities. So Mr. Bergman will explain some more of that for us. What's that?
From here?
Yeah, yeah, yeah. Yes.
Oh, well, thank you. Thank you indeed for the invitation. I'm almost as surprised as the previous speaker. But indeed, it is an honor for me to have been invited to participate in the conference today, together with my friend and colleague, Dr. Damanle. In actual fact, I think it's 10 years since I visited this conference. Not this conference, but with people to people. So it is not the first time I am with. Someone showed a picture just a short while ago. I forget names now, but a picture with some are thinkers and some are doers. Was it? Yeah. Dr. Benya?
Yes.
Yeah. And I would say that Adamo and I and our organization that we work for, we are more of the doers. So we are a little bit of strange fish in the company today, because you are professors and doctors and academics, and we are working in many ways in a more practical way. But we have had the privilege, and a lot of it, of course, or mainly thanks to Dr. Adamo, we've had the privilege of working with, through and in Ethiopia for many years now. We have supplied large volumes of hospital equipment and materials. If I just may say a couple of things there. Dr. Lekadelo, I think.
Yeah.
You'll have to forgive me for my pronunciation and so on. But well, one of the challenges she gave was, what can we, or what will you as participants of the conference be able to bring to the table? What can you bring to Ethiopia and the medical system there? And yes, in that respect, we are not strange fish, because we know that we can participate with what we can do, and that is with equipment. I think in 2016, in a discussion with one of the presidents of one of your larger universities, and I'm not going to try to remember the name because I will say wrong. I'm sure Dr. Dam would remember. But he said to me that, and to us, that that particular year, I think I may have the figures wrong, but approximately 1,800 medical doctors graduated in Ethiopia. And then he said the following. I think it was almost 2/3 of those doctors then left Ethiopia, and a lot of it due to the fact that the system has a difficulty accommodating the doctors, because there's a lack of material, lack of equipment, and so on. And please understand me when I say, when I describe this. This is not saying anything against those of you that are here, because those of you that are here, you are involved in, as diaspora, but also as working in Ethiopia, involved in thinking, what can we do for Ethiopia? And that is fantastic. And we need the diaspora. I say we, I'm not Ethiopian. I'm African. I'm born and raised in South Africa, even though that's 40 years ago, but I am African. As diaspora, we need to be participating in us and helping to build up Ethiopia and the countries that we may come from. But what we can do, the same president said, university president, then described to me the fact that there are hospitals that have received equipment from Human Bridge that are now finding it easier to recruit doctors. They are finding it easier to have doctors come for their final training, and they're even staying on. And their status is different because they are working in hospitals where there is equipment, as compared to hospitals that have no equipment or that have a lot less equipment. And so what I'm saying is the input that we can do together, I think, is of such utmost importance. We are not bragging about what we can do, because we don't have no reason to do so, but we have, when we hear things like that description, then we understand that what we can do when we can bring in equipment, when we can assist hospitals, when we can assist universities, university hospitals in raising a little bit of the level of the care that they are able to give, then we are creating sustainable development within the hospital system in Ethiopia. And we need to be there from our point of view, and then you folks need to be there with the expertise and the encouragement and the finances and the resources that you can bring in. And together we see that there is change and there is a positive effect on the medical system in Ethiopia. And as I say, it's 10 years since I had the privilege of participating in the conference here. And we were then given an award by the Minister of Health at the time. And we are here 10 years later, and we will be here, I'm sure, in 10 years to come as well. Because we are encouraged by people to people and all the activities that are being done, and it inspires us to continue as well and to be a part of the development. So thank you so much, and once again, thank you for allowing us to participate here today. Thank you so much.
Thank you.
Thank you.
Thank you so much. Hey, any questions from the audience? And otherwise, I think we're getting ready to. Yeah. Okay. And then we will take this opportunity to kind of strengthen and further consolidate our work with the Human Bridge and sign the memorandum of understanding.